My name is Tatjana Stankovic. I'm professor in cancer genetics at the Institute of Cancer and Genomic Sciences, University of Birmingham. We carry out research that we call translational research. That means that we, first of all, acquire knowledge about mechanisms that are involved in disease development. Then we learn about consequences of disease at the level of cell. And then we learned how to correct that defect that is causing disease. And finally, we are moving our knowledge towards designing and conducting clinical trials that change outcome of disease for patients. The total cost of the study is £120,000, and we are proposing to use an animal model that we developed, which recapitulates all blood cancers that patients with Ataxia Telangiectasia develop, which are leukemias and lymphomas. And we will test novel, less toxic treatments for Ataxia Telangiectasia patients in this animal model. So we already identified that particular protein called c-MYC protein is extra active in blood cancers that develop in patients with Ataxia Telangiectasia. And we will use our animal model to actually counteract activity of this protein. This protein is responsible for uncontrolled growth of cancer cells. And we will use a new line of drugs that we call small molecule inhibitors that will, in different way, stop activity of this c-MYC protein. We will perform tests first in laboratory conditions using cell lines obtained from blood cancers in general population lacking ATM protein, but we will also use cells for lymphomas and leukemias developing in animal model that we developed. And finally, we will use tumor growing in animals to treat them with the same inhibitors. The faulty gene in Ataxia Telangiectasia, called Ataxia Telangiectasia mutated genes, is creating a protein that is involved in response to DNA damage. And because 80 patients cannot respond to DNA damage properly, their cells acquire more and more changes and have a great risk of becoming cancer cells. At the same time, because of this inability to respond properly to DNA damage, such a cancer cells cannot be treated with chemotherapy successfully, because chemotherapy also induces DNA damage. So we have this vicious circle. On one side, patients are developing blood cancers and other cancers. On the other side, we cannot treat them properly with chemotherapy. This study is very important for 80 patients because there are no satisfactory treatments for their blood cancers. And it's important to stress that many patients die of their blood cancers. So we are hoping that these new strategies will be less toxic, will be more efficient, will lead to cure of some patients with Ataxia Telangiectasia, their blood cancers, and will provide them with a better chance of longevity and better chance of other treatments that will cope with their neurological symptoms. I strongly support people giving money to Action for AT because it is charity that supports rare disorders with a very high predisposition for development of cancer. We're talking about 300-fold increase. What is also important that ATM gene not only is associated with Ataxia Telangiectasia, but it is very frequently altered in cancers in general population. So what we learn from ataxia telangiectasia, we can apply for frequent cancers in general population. And what this kind of research brings is what we call precision medicine, meaning specific treatments for specific categories of patients.